Hello everyone, I hope you are doing good. Welcome back to my channel. So today I am going to talk about visual autism, which is a recent hype debate on the social media and all around. Visual autism, as per my information, is a term that was at first coined by some Romanian psychologist, and the psychologist describes that in children under the age of 2 years, autism-like symptoms appear because of the excess usage of the screen. Now, the many parents or the therapist currently confuse it with autism. They think that visual autism is some type of autism that is because of increased screen time and it gets cured. Well, there are certain things that I want to clarify. First of all, visual autism can only be apparent in the children under the age of 2 who are toddler, and they are having excess screen time, and they refuse to socialize much with the adults, and they prefer to increase their screen time. The children of age around 4 years, 5 years, 6 years, 7 years, they can't have visual autism because they are too old for that. Number two, visual autism is not autism. It's not type of autism. It has nothing to do with what we call autism spectrum disorder. Because, according to the psychologist, if you reduce the screen time of the child, the symptoms of visual autism can be reduced or it can be cured. But once a child is diagnosed with ASD, autism spectrum disorder, it is a lifelong condition and it cannot get away. Number three, it's not necessary that every child who uses excess screen has a visual autism and not the autism. For example, there are so many children, there are so many even toddlers, so many children under 2 who use a screen a lot. Their screen time is a lot, but they function just fine. For example, if you take the phone or iPads away from them, uh, you don't see any problem with their social interaction, with their sensory development, with their speech and language development, and stuff like this. So we cannot say that screen time, increased screen time, is gonna affect all the kids, and all the kids doing excessive screen time are gonna have autism like symptoms. No, this is not true. So well, I just want to say that autism is a different thing. Visual autism, virtual autism, it is entirely a different thing. Let's not confuse the two terms. And those children who have autism symptoms, who have typical red flags of the autism, must be dealt seriously, must be provided therapeutic interventions seriously, and the parents should be very much clear about this stuff, that what is autism spectrum disorder. Visual autism is just something that you need to worry less about it. I hope I have made myself clear, because what is happening is, there are so many parents who says that, well, he uses increased screen time and because of that he has developed virtual autism, and I have read about it. So once we reduce the screen time, the autism is going to go away, whereas the child exhibit all the red flags of the autism: stereotypical patterns, behaviors, hyperactivity, hand flapping, lack of socialization, lack of eye contact, and all that stuff. And it becomes harder to explain it to them that no, this is not visual autism, this is autism, actually ASD. So let not confuse the two terms. I know that it is very much evident in the parents to take refuge in the little hopes that they get, and yes, it is very important and you are right there, but it is also important that you are well informed about all the terms that are being used. And to all the therapists, you must be very careful when you tell a parent that your child exhibit symptoms of ASD, autism spectrum disorder, or you think that it is visual autism. Well, a child exhibiting symptoms of visual autism must not show the other red flags or red signs of autism. However, he must function a little bit differently because of his excessive screen time. And in visual autism, the symptoms must go away once you reduced the screen time. However, this is not the case in autism, because in autism, even if you decrease a screen time, the symptoms stays, which is the proof that the symptoms are there because of the autism spectrum disorder. The symptoms are not there because of excessive screen time. Do read more about it, and I would advise you to please do a consultation with a professional having the experience of diagnosing autism spectrum disorder to avoid any confusions, because on the internet there's a lot of stuff there. Most of it is very confusing, most of it is not true, and most of it requires more research. So do spread the message as well. Don't forget to subscribe to my channel, and feel free to ask any questions regarding anything that you want addressed. Thank you.